Welcome everybody to the latest segment of The Break. This is PIA's informational series tackling some bigger issues in insurance, COVID-19 related most recently. Today we are going to be discussing the implementation of New York Forward guidelines for offices during the COVID-19 crisis. New York State, the majority of the state has moved forward to phase two. Phase two allows offices to open as long as they meet certain requirements. So Clare, Irvine is here to talk to us today about those requirements. I should mention that I'm Brad Lachut, the Director of Government Affairs for PIA Northeast. I'll turn it over to Clare to take us through what the guidelines are.
Hi. As you probably have heard, New York has started entering phase two of the reopening, and that includes offices. So they've also helpfully given guidelines, many of which are mandatory and others are recommended best practices for businesses throughout the state, offices throughout the state to follow. I will note that commercial buildings have their own requirements. So if you're in a building, if you're a tenant of a commercial building, your building owner might have separate requirements. That would be something to just keep in mind. And I'll probably reference it going forward. But for offices specifically, they broke it up into five areas to focus on when reopening. First, there's physical distancing, then there's the protective equipment, hygiene and cleaning, communications, and screening. So we'll go into break down each one of these and what's required for all offices in the state to reopen, as well as what the recommended best practices are. I will note that most of these are not expensive, minimal cost to offices, and typically the more extravagant and complex ones are recommended best practices. They're not required. So if you hear something and you're like, I have no idea what that is, and I don't know if I can afford it, it's recommended. So first, we'll start with the physical distancing and what is mandatory. And a lot of this comes down to the idea, keep in mind, of promoting social distancing wherever possible and people staying 6 feet apart. So the first way to do that is to limit the number of total occupants in your office at a given time to 50% of the maximum occupancy. And maximum occupancy is the amount determined by the fire marshal, amount of people determined by the fire marshal in a given space. So it's not the number of employees, it's the maximum occupancy that your official maximum occupancy number. So if you have, let's say, maximum occupancy of 50 people, but you only have 20 employees, all 20 employees can return and you're still below the 50% maximum occupancy. Once people are in the office, it's important to try and maintain a distance of at least 6 feet amongst individuals wherever possible. So there are certain situations, such as in construction, when you have a two-man lift, you have to have, for safety reasons, the two-man lift, people are coming within 6 feet. In that event, face coverings must be worn when the distance isn't maintained. And that just also includes even moving within the office, people should be prepared to wear the face mask if they're going to come within 6 feet of other individuals. You're required to prohibit the use of tightly confined spaces by more than one person unless everyone wears a face covering. The examples given are elevators or vehicles. So if you have an elevator in your office, make sure that either only one person's using it at a time or everyone is wearing a face covering, or one person's using it while wearing a face covering. Really overachieve there. But throughout your office, post social distancing markers, reminding people in cases such as the elevator, what they have to do to maintain social distancing. Limit in-person gatherings as much as possible. Don't cancel that Zoom subscription just yet, or delete it from your computer. You're still encouraged to take advantage of telecommuting, telework, and video conferencing as much as possible, even if everyone you're video conferencing is in the same building. In cases where there's shared workstations, make sure they're clean and disinfected between users. So if you have something like a front desk that always has someone at it during office hours, even when the person who mainly works there is at lunch, make sure it's clean and disinfected when people are filling in for each other. To the extent possible, reduce interpersonal contact and congregation. So in cases such as the kitchen or shared space, trying to discourage people from congregating there to share their weekends. They can do that over Zoom. And non-essential common areas must remain closed. The examples given in the guidelines are things like game rooms, gyms, and pools. So Office kitchen is presumably still okay because people have to eat and there's probably a hand washing station, but you just still don't need a game area quite yet. And if employees want to play games, that's its own. There are plenty of ways to do that without a game room.
Zoom games.
Yep. And then there's physical distance recommendations for physical distancing within the office. And so these are recommended best practices. They're not required. So the first is just to modify and reconfigure workstations. So if people are working closer than 6 feet, or they're all working in a line so that they're line, kind of reconfiguring to try and try and maximize the distance between employees. Another thing is to implement a strict clean desk policy where pretty much all non-essential items on desk are stored in drawers or on shelves so that it's very easy to clean the space. Limit use of shared workstations whenever possible. You might have something like a reception desk that people still have to share in order to make sure phones are answered. But in cases like a hot desk where people kind of come to work and pick the desk they're at, that should probably be put on hold for the time being. Use technology to qualify and display utilization of spaces throughout your office. This is I've read this as more of kind of the trendier companies that have a hot desk or like have software that will track where people are and where they're working at given times. They're being encouraged to use that technology to kind of manage where people are and promote social distancing. If you don't have that technology, and what I'm saying in the last couple sentences, it makes no sense to you, don't worry about it. This is, again, a recommended best practice. You don't have to go buy this software and figure out how to use it just because it's on this guideline. Similarly, you can also just, on the opposite end of technology, take some tape and mark 6-foot circles around workstations and common stationary work areas. So somewhere like a printer, just mark 6 feet behind it, so that with some tape on the grounds, so that people know people don't congregate by a printer or a shared water cooler. Water cooler talk can be shouting across the office for the time being. Reduce bi-directional foot traffic with signs. So if you have a hallway, put signs so that people stay on the right-hand side or the left-hand side, or have it, if there's multiple ways to get around the office, have one hallway go one way, be walking one direction, another hallway in another direction. And limit on-site interactions in a similar way. If you have multiple entrances and exits to your office, have one designated as an entrance, another designated as an exit, so people aren't kind of running into each other and doing the little dance you do when people are trying to go opposite ways through a door. Add and move desks to areas previously used for group gatherings. So if you have meeting areas where you're not allowed to have meetings, it's highly recommended you avoid having meetings. Maybe move a couple people into that work area instead, so that they're to maximize the space for social distancing purposes. Close non-essential amenities in communal areas. Stagger work schedules to encourage social distancing. So instead of everyone arriving in the same 10-minute window just before your office opens, kind of have it so people are arriving over a course of a couple hours and also leaving over a course of a couple hours, just so there's less congregation as people arrive and leave work. And also just consider limits on non-essential travel. So that's a lot about social distancing. And one key thing was, when it's not possible, face coverings. Now become very, very used to face coverings. I'm sure we'll still be wearing them for foreseeable future. And for businesses, you are required to provide your workers with acceptable face coverings at no cost to employees. So those acceptable face coverings include surgical masks. They include like cloth masks, as well as bandanas. So if you want to go and get all your employees branded bandanas for your agency, that will meet the requirement. In business, once you do so, you must advise workers on where the personal protective equipment is required in the office, and limit sharing of objects and touching of surfaces without gloves or hand washing. And along the same line, the recommended best practice is to also maintain adequate personal protective equipment for all visitors as well as workers. You're required to maintain it for workers, but you can also make sure you have them for visitors in the event that they left theirs at home or don't have one. So that's really up to you and depends on the visitors you might have in your agency, or if you have 8 visitors to your agency in the foreseeable future. So for the next big one is hygiene and cleaning and what is mandatory. So you're first required to adhere to all CDC and New York State Department of Health hygiene and cleaning and disinfection requirements. So those are detailed in the guidelines, and those are further detailed in the guidelines. They're linked to on those websites, and they're something you should check in regularly because they're frequently updated, particularly during the current pandemic crisis. You should maintain cleaning logs on site that document the date, time, and scope of the cleaning. So if you do an intense cleaning every night, but you also kind of do 1 or 2 disinfectings during the day, you can note the scope of each cleaning. Provide and maintain hand hygiene stations in the office. So that includes warm water and soap where possible, but also hand sanitizer that has at least 60% alcohol content at entrances or in other spaces for employees to access. And then once you have those provided, you should also encourage the use of the hand hygiene stations, especially before and after the use of shared and frequently touched surfaces. So if you maintain your kitchen and you know people are always going to be going in and out of the fridge, encourage people to wash their hands before opening the fridge and then after closing, just to minimize any potential spread for the frequently touched surface. Ensure all equipment is regularly cleaned and disinfected using disinfectants and cleaning products approved by the New York State Department of Environmental Conservation. That doesn't mean they're still they're probably chemical heavy, but that means that they're safe for employees to use. They'll safely disinfect your office without also causing further harm to your employees by being too strong. Make sure to regularly clean and disinfect your work site, especially the high-risk areas and frequently touched surfaces. The rigorous cleaning and disinfection must occur after each shift at a minimum. So if everyone in your office works kind of the standard 9 to 5, that means at least one everyone leaving at 5 p.m. or the new flexible window and arriving the next morning, make sure everything's been rigorously cleaned and disinfected. But if you have 2 shifts or something, 2 or 3 shifts, then it has to occur between each shift throughout the day. And prohibit sharing of food and meals. There goes all buffet lunches for the next couple of years. Hope you enjoyed the last one you had, because that's the last one you're gonna have for a while. And make sure to clean and disinfect areas in the event individuals test positive for COVID-19. The guidelines for doing so are included in the New York State Forward guidelines, and they're they lay it out fairly clearly, including waiting 24 hours, ventilating the area, rigorously disinfecting and disinfecting again. So if someone in your office tests positive for COVID-19, the guidelines should help guide what you should do. And then for recommended best practices, it's encouraged that you avoid furniture that is not easily cleaned or disinfected, and increase ventilation of outdoor air where possible. The example they gave for this was to open a window. So it's not, you don't have to go mess with your ventilation system. If you have windows that open, that's a good way to get fresh air flowing in and get more air circulation in your office. So you have all these protocols and everything drafted. It's also important to communicate with them with people, both working in your office and visitors. So first you have to affirm that you've reviewed and understand the state issued guidelines, and then post signage inside and outside the office explaining what you're doing in terms of proper hygiene, social distancing, PPE requirements, cleaning and disinfectant protocols. So this way, everyone coming into your office, whether they're a worker, contractor, or a visitor, has the ability to see what all these proper protocols are. Within your office, make sure to train all personnel on the new protocols and frequently communicate the safety guidelines. Have an established communications plan to consistently provide updated information for employees and visitors. That way everyone knows what's going on, and keep it fresh in their mind, because what you communicate in June is old news in August, particularly at how long this year's been going. It's basically a decade. I'll have aged half a century by then, fairly certain. Make sure that building managers, particularly if you're a tenant, have a list of essential visitors expected to enter the building. And maintain a continuous log of every person who may have close contact with other individuals at your worksite, including visitors. So this is keeping track of who's in and out of your building is good, and it's good to have for security purposes, and we'll hit why it's good for this in a couple slides. In the event that a worker or employee tests positive for COVID-19, you should immediately notify state and local health departments, and make sure to have all safety plans posted conspicuously on site. And you can also just email them to your employees, because I'm sure that's how a lot of people have been communicating right now, and also how you communicate in your actual office. And for recommended communications practices, it's developing web pages, text and email groups, social media campaigns to inform workers, customers, and visitors of COVID-19 safety protocols within your office. So if you do get a lot of visitors or walk-in traffic, having those protocols on your website is probably a good idea, so they know to bring their own face mask when they come meet with their insurance agent. If you're a tenant of a building, work with the building management to facilitate any of their building-wide communications. As I said, commercial building managers have their own guidelines to follow. So they will probably be following up with tenants to ensure that they're meeting their requirements. So make sure to work with them to coordinate. Makes life easier, and is also highly recommended. And make sure to post, it's recommended to post signs inside and outside the building to remind individuals to adhere to all the hygiene, social distancing, PPE, cleaning, and disinfectant protocols. So this is things like taking inspiration from restaurants by posting the must wash hands signs near sinks, particularly if they're touching frequently touched surfaces, or just suggesting, hey, it's a good opportunity to wash your hands while you're reading this sign. Similarly, with recommending when they should be wearing face masks, that they should have face masks when entering the building, etc. So all of this, the goal is to prevent the spread of COVID-19, and the best way to do that is to try and prevent people who might have COVID-19 from even coming into the building. So first way to do that is all workers who are sick should stay home. And right now, the federal sick leave allows them to still get paid for staying home for up to 10 business days. So if you have an employee who is sick, they can take advantage of that leave and stay home. We have further information about that. Similarly, if they can work from home, they can continue working from home if they deem that they're well enough. It doesn't mean they can't work, it just means they shouldn't be in your office. And if someone starts getting sick at work, they should go home. To try and limit anyone who is sick from coming to your office, implement a mandatory health screening assessment for all employees, contractors, and other visitors. And you can coordinate this screening with building managers if you're a tenant. All tenants are responsible for screening their own employees and visitors, unless they work with the building managers for an alternative. So if you're a tenant in a building, you're responsible for screening your employees. If you have on-site screeners, they should be trained by employer-identified individuals familiar with CDC, New York State Department of Health, and OSHA protocols. This is if you have the on-site screeners. It's not requiring you to have the on-site screener. I'll just make a note of that, because I'm sure that is not something you need to go out and hire. You should make sure to identify a point of contact as a party for workers and visitors to inform if they later experience COVID-19 symptoms. So this is someone in your office where if someone gets sick, they contact that person, and that person will know what to do going forward, with both notifying people that they may have had contact with, and notifying the state state and local health officials. And then have a plan for cleaning, disinfection, and contact tracing in the event of a positive COVID-19 case. So for the mandatory health screening assessment, I said you don't have to have an on-site screener if you don't already have one, but there are several questions that people should be asked before arriving at work or in your office, whether they're an employee, contractor, or visitor. The first is if they've experienced COVID-19 symptoms in the past 14 days, and if they have tested positive for COVID-19 in the past 14 days, and or if they have had close contact with confirmed or suspected COVID-19 cases in the past 14 days. So make sure if anyone's entering your building that they're asked these 3 questions, and if they say yes to any of them, they should either not be in your office or go to secondary screening to kind of get more details of what their situation is. And businesses should review and document responses daily. So something where you should make sure that people are considering it every day and that you are reviewing any responses you receive. How you go about the screening is really up to you, but it's something you should be tracking constantly. And in the event that they say, there are situations where people are required to self-quarantine, and the requirements are if they have had COVID-19 symptoms and either test positive or don't receive a test. If they do test positive for COVID-19 without experiencing symptoms, or if they has had close contact for a prolonged period of time with a person who tests positive for COVID-19. So the prolonged period of time is not, it doesn't mean someone who also shops their grocery store tested positive for COVID-19 and they may have come in contact. It'd be more of someone they live with or someone they spent part of the weekend with to end up testing positive for COVID-19. That would be a situation where they want to self-quarantine. Per these guidelines, these are things you should follow. These specifically are something you should follow from the CDC and Department of Health closely going forward. But if anyone is under self-quarantine, whether they're sick or not, they should not be in your office. It doesn't mean they can't work. Again, if someone tests positive but they're not experiencing symptoms, and they're capable of working remotely, they can still work remotely. They just cannot come into your office. And the federal emergency sick leave, those 10 business days that are covered, those cover self-quarantine even if they're not experiencing symptoms and should provide people with paid leave for the self-quarantine. So that's something to look into as well. And then if any employee does test positive for COVID-19, employers must notify state and local health departments immediately. And once you contact them, you must cooperate with contact tracing, including notifying of any potential contacts that person had within your office, while still maintaining employee confidentiality per state and federal law. How that exactly will play out is something you should keep in mind, just because it's difficult to both say, hey, like who in the office has come in contact with Brad, while also trying to maintain someone like Brad's confidentiality for health things. But it's trying to weigh those is something that you should really keep in mind when notifying people that they may have come in contact with an employee with COVID-19. Similarly, the contact tracing is why it's really important to keep a log of anyone who's been in your office and kind of where they're in your office, because someone might be in your office but in a completely different department. So it's not necessary to inform everyone in the building if you have reason to believe that they did not come in contact. So it's notifying. The key though is notify public health officials and cooperate with them going forward, because they all had to hire a lot of contract tracers in order to get to this reopening point. And beyond all of those were all the mandatory screening requirements. There's also recommended best practices, which include preventing workers and visitors from mingling in close contact with one another prior to completion of the screening, conducting daily temperature checks per EEOC or New York State Department of Health guidelines, maintaining a log of workers and visitors, tracking who workers and visitors may have had close contact with, screening individuals at or near a building entrance if space permits to minimize impact of positive COVID-19 tests, coordinate with building managers to identify any individuals who have completed the remote screening, and using screening tools in building entrances to identify potentially symptomatic visitors, directing any potentially symptomatic visitors to secondary screening areas, and coordinate all of this with building management where possible. A lot of these are things that are probably not feasible or just not really considerations for a business in upstate New York. But when you have the high rises in New York City, which are also offices, also required to adhere to these guidelines, having things like temperature checks at buildings where thousands of people work and secondary screening areas are more of a consideration. So that's something to keep in mind, is that these guidelines are both applying to a 4-person office in the southern tier, mid-size office in Buffalo, and a high-rise in New York City all have to adhere to the same office guidelines. So some of these seem like they don't really apply or might not be feasible. That's probably why, or one of the many reasons why. And so after you've done all this, you need to, the main requirement from New York State for a business to affirm that they are adhering to the guidelines is to certify that on the interim guidance for office-based work during the COVID-19 emergency. That is one of the links below, and it's also pretty much the document I read, so you don't have to. You should still review it and still make sure you know it, have a copy of it handy in the event that you do have a COVID-19 positive case and want to refer to it going forward. But you need to go to the bottom and affirm that you have read, understand, and will adhere to the mandatory requirements. New York State also made it very easy to adhere to the requirements by creating a safety plan template. So that's also linked to below, and it has check boxes that you've done certain things, and also blanks, boxes that you can fill out with people like contact information and where hand washing stations are. So that makes it very easy if you've been looking at this text and thinking this is a lot. That makes it very easy to draft the protocol, and then once you have that, you can send it to employees, post it in your office, make it available to everyone. So that is also linked to, both those documents again are linked to below, and they contain further information. There's also another document below that kind of lays out all of this with a column for mandatory and recommended best practices that makes it that you can refer to, that's also from New York State. So it's plenty of ways to see this because it's a lot of information, a lot of it's required, but not really costly, just maybe time consuming. So those are all things to, once you're finished this video, you should affirm that, or once you're getting ready to open your office, make sure you have these in place. If you have further questions on this topic or related issue, please feel free to contact myself, Brad, or the PIA Resource Center. We'd be happy to help with questions or any further concerns you may have on this or related topics. So with that said, I'll turn it back over to Brad.
Thank you very much, Claire. Obviously, that was a lot of really critical information for all of us to know to open up offices safely. So I do have 2 questions, some of them that you kind of addressed, but I want to make sure that people understand. First of all, the question would be, if you have a business that has multiple locations, is it okay for that business to have one COVID plan, so to speak, or do they need to have an individual plan for each one of their locations?
I think that's a great question. There's nothing specifying that businesses have to have the protocol per location. As long as the information would apply to every location, then the same plan a business could use the same plan for all office locations. Similarly, the template makes it very easy to kind of tweak information for each location. So there's a different person to contact in the event of a COVID-19 positive case, or a different point person in each office to administer the protocol. You can switch that and otherwise use the same information. So it's very adapted to what your needs are, but you don't have to have a different one for every location. Don't
reinvent the wheel for every location, right?
Yeah, a lot of these policies are probably going to be about the same, but there might be small differences. They're just location based, so you can just tweak it for each one. You can also just list all of those people in the same plan in the event that people go between locations. There's plenty of blank space at the end to kind of add additional information as is necessary.
Good point. The next question I have, actually the last question, in terms of who's got to follow this guidance. Sometimes we get the question of, well, I only have 5 employees or I have 10 employees. Do I need to follow this guidance? Is there different rules for me? It doesn't appear that's the case, but maybe you can clear that up.
No. Well, I think the difference in rules is really that the mandatory practices are fairly low cost, and they might, depending on the size of your office, be more time intensive. A bigger office is going to take more time to do so, to really put up these safety notices and tape and all of that stuff. But the mandatory ones are any office can adhere to, and the really more expensive and complex ones were all recommended best practices. As I said, it's a 2-person office in the Finger Lakes has to do the exact same thing as a finance company on Wall Street.
Great point. Well, that's all I have, Claire. I really appreciate you walking us through this very important information because, again, this is critical stuff for everybody to know. Anything else before we close out?
Nope, just stay tuned for further information as offices start reopening and getting back out there.
And for those of you who might have offices or clients in other states, we will be doing a similar one of these for other states as they release further guidance in terms of reopening. So stay tuned for that as well. With that, thank you all for joining us, and we'll see everybody soon.